all of you to our January 1st board meeting. Thank you. First item on the agenda is the Pledge of Allegiance. So I will stand and bring us to that. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Next item on the agenda should be roll call. So Sheila, if you would, please.
Mr. Torres? Dr. Todd? Ms. Root? Mr. Cowan? Ms. Namie Dyer? Ms. Newman? Dr. Hahn?
Here.
Mr. Furman?
Here.
Ms. Bernard? Mr. Landsman?
I am here. I also received an email from Ms. Bernard saying that she would not be able to make this call, but she might be attending as a member of the public at this point, since we all have to be here in person to do any official business. Next on the agenda is the approval of tonight's board agenda, so I'm looking for a motion for that approval.
So moved.
Thank you, Mr. Furman. Is there a second? Support. Thank you, Ms. Newman. So we have a motion. We have by Mr. Furman, second by Ms. Newman. Is there any discussion on the agenda? Hearing none, let's call a roll call.
Dr. Hahn?
Yes.
Mr. Furman?
Yes.
Ms. Newman?
Yes, but there's something wrong with my
Ms. Namie Dyer? Dr. Todd?
Yes.
Mr. Cowan?
Yes.
Ms. Root? Yes. Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Next item on the agenda should be our public comment. Is there anyone who either here in the building or electronically would like to present and make public comment?
Sorry, having some mic issues. We do not have any public comment in the online chat, and I don't believe we have anyone in the room who would like to provide public comment at this time, but we do have a second opportunity for public comment at the end of the meeting.
Okay, thank you.
You're welcome.
All right, next on the agenda, item 2 is our introduction of our new corporate compliance officer. Dana, you have the floor.
There it is. Good evening, everybody. Dana Lassenby, CEO for OCHN. I want to take this opportunity to welcome and introduce Mr. Bernard Hooper. Mr. Hooper is our Chief Corporate Compliance and DEI Officer, and in his role, he will lead our corporate compliance program and function as an independent and objective body that will review and evaluate our compliance issues and concerns, as well as guide the board of directors, management, and employees on following the rules and regulations of regulatory agencies, that company policies and procedures, and that make sure that they're being followed, and the behaviors in the organization meets the company's standards of conduct. Also, as the DEI strategic plan, he will lead the development and implementation of OCHN's DEI strategic plan and lead the efforts to instill DEI best practices throughout the organization. Please join me in welcoming Mr. Bernard Hooper.
Mr. Hooper, do you have anything that you'd like to share with us on the board tonight, or you just prefer to stay in the shadows for now? Thank you. And for those of you that recognize him, he used to be at Detroit Wind, and you may have seen him at some of our conferences as he was staff there. So, welcome aboard. Next is one of my favorite items on the agenda, which is Stories That Inspire. Tonight it's with Community Housing Network. So that's with Mark Craig. And we give you guys the floor. They are? Okay. So you guys will flag us when you're connected, and what we'll do is we will move on and come back to your story about Community Housing Network. Are they on? No, it sounds like you're on. Dr. Hans, the reason that we can hear it from there is because there's a speaker button that if you click on that, that'll mute the speaker too. Okay. So I'm going to move on with item 4, which is Board Executive Committee reports. And so I'll start with my report, and then we'll move through these. Well, with you, Melchiah, Ms. Newman, after me, because Rena's not here right now. So, so my OCHN Board Chairman's report for January 22nd. While scheduled as an in-person meeting under the rules of OMA, the Executive Committee did not meet this past 2 weeks ago on January 5th at 4 p.m. We had several excused absences that we knew about, and as a result, we knew that we would not have a quorum. The CEO Evaluation Committee meeting was also canceled. And one of the questions that I would like to raise is, should the Executive Committee meetings be subject to OMA? We're a subset of the board. We're less than a majority of the board. I still believe in posting it as a meeting, recording it, but for our purposes, since we don't make decisions typically at that meeting, I wondered if there's an opportunity for us to continue to meet when needed by phone. And Kalana, you're coming up to the mic, so let's see if we can get a mic working. And would you like to use mine?
Here we go.
Here we go.
Okay. Kalana Ali, Chief Legal Officer for OCHN. Per your question regarding whether you must comply with the OMA, it is my understanding that the executive committees, both the Director of Performance Review as well as the Executive Committee, they do make decisions at those meetings and do have discussions that should be subject and would be subject to the OMA. We can go into the details if you like, but in terms of like setting agendas and having those things put forth, those are decisions that are being made. So
Okay.
you just want to be mindful and err on the side of caution, because in addition to that, if there are any discussions that occur during those meetings that are in furtherance of board business, that could be a violation of the OMA as well.
Okay. And I could understand the CEO Evaluation Committee. I just wasn't sure about the Executive Committee.
Yeah.
Especially because sometimes it does make it challenging.
Perfect.
Okay. So I'm going to keep, but thank you. So we will keep it as an OMA. We'll still publish as well, just because that's good form, either way. So one of the things, the January agendas for last week's Committee of the Whole meeting, tonight's board meeting, and for next week's Thursday's study session were all previously established at our prior study session. So on that topic, next week's study session has the following topics: community engagement and public events training with Christine Burke, public comment with Linda Bartoloni, Till, and DEI update with Trish Zimbo. So, yes, Sheila.
I also added an agenda topic with your, Mr. Bernard Hooper is going to give a description of his role and position here, and as far as how it pertains to the board.
I think that's awesome.
Okay.
Thank you. So there we have it. We have 4 items for the agenda. I would ask that people remember it, put it on the schedule for next week, Thursday at 5 p.m. That's the 27th. So news from our CEO. Dana reported that the School Mental Health Navigator Program was approved by the Board of Commissioners Health and Safety Committee on December 9th. We've also been involved with the Oxford crisis providers, including Common Ground, Honor Health, Easter Seals, and other providers who volunteered throughout our network. And then as well on Thursday night, Dana will be presenting an upcoming Board of Commissioners meeting. So I just raise these as other ways to identify or demonstrate where and how we work closely with our community across the county. So not just persons we serve, but the citizens of our county. In terms of other business, the CMHA Winter Conference is scheduled for February 8th and 9th. It is virtual. Is there still a possibility for people to register for that, Sheila?
Yeah, but I would have to know today. Today, I only have 2 board members that notified me, and that's yourself and Ms. Newman. Yep. So if anybody else did notify me and I didn't catch it, please let me know. I'll register.
Hey, again, it's virtual. I think everyone's seen the brochure on what topics are covered. If not, Sheila can send it to you. You can always go out to the CMHA website. It'll be out there as well. Next item, remember to RSVP your attendance to our upcoming meetings so that if there's food being made or food being served that for the board members, then that we don't overbuy. Let's not be wasteful. And then please continue to advocate for the continuation of our public solution. That's us, by reaching out to your state senators and to others. Mine is Jim Rumstead. I call him pretty regularly. He doesn't call me back, but at least I'm reaching out. He knows that we're pushing for the continuation of our organization to deliver services. And lastly, keep your social distance. Even if you're fully vaccinated, please don't let the pandemic fatigue catch you, and therefore you catching COVID. So that's my report for tonight. Any questions? All right, with Rena not here, I'll move to the other executive on our board. Ms. Newman, do you have a report?
Mr. Landsman, the Stories Inspire Hope, they're all on, so I don't know when you want to fit that in the agenda.
Let's wrap with our executive board committee reports, and then we'll come back to her.
For the policy portion of the Committee of the Whole, we had a very extensive recipient rights summary with Vicki Suter and Jean Fintner. And that concludes my report.
Thank you, Ms. Newman. Okay, now at this time we're going to bounce back to Stories That Inspire and welcome Community Housing Network.
Okay, I think I have my camera and microphone on. Can everybody hear me?
We can hear you and see you.
Beautiful.
Good evening, Mark.
Good evening. Thank you. It's good to hear your voice again. I'm Mark Craig, and I'm president of Community Housing Network. And joining me tonight is Kirsten Elliott, who's vice president and chief operating officer. And we can go to the next slide. And we're going to try to keep this concise tonight. So, and you've got copies of the PowerPoint, I believe. So I'm going to just highlight some points instead of just reading from it. First, our mission is to strengthen communities, and we believe that strong communities strongly include people with disabilities and people of varying backgrounds, which means that people with disabilities, the folks served by OCHN, and others who've experienced homelessness or other social conditions have an opportunity to live next door to someone who's had a different life experience than they have. And our vision statement is twofold, 2 points that I'd like to underscore. One is that we strive to achieve a positive social impact, which means that every community across Oakland County is going to include folks, again, folks with disabilities, folks of different backgrounds. They will be welcomed and be able to live successfully in any community in the county. And secondly, that we do achieve our mission through partnerships. And our strongest partnership over the last 20 years has been with OCHN. So we can go to the next slide. I want to introduce our senior leadership team. I've introduced myself. I'm president of Community Housing Network. I've been with Community Housing Network for 20 years. Kirsten Elliott has also been with Community Housing Network for 20 years. She'll be joining us shortly, and she is our Chief Operating Officer. Carrie Mendoza is our Chief Financial Officer. We managed to steal her from a large public accounting firm. And Shelley Brinkman is our Vice President of Real Estate and handles all of our property management and other real estate related activities. You'll hear more about that shortly. And I'd like to just mention briefly that at least a couple members of our leadership team have lived experience, have family or have immediate family members who've experienced disability or homelessness. Okay, next slide. And a few points that I'd like to underscore about our story. First, we began in 2021 or 2001 rather, which is 20 years ago, just as of a few weeks ago, with as a pilot project of this board that we're speaking with this evening. And there are still a couple of board members who can remember our humble beginnings. And we started out to achieve three things. We wanted to handle property management for housing for people with disabilities served by OCHN. We wanted to create a housing resource center. You'll hear more about that in a little bit. And we wanted to develop affordable housing options for people with disabilities served by OCHN. And I'm going to briefly mention a couple of the people that you see on this slide, which are a couple of the really stories that have really shaped my career experience. The guy on the top is a fellow named Jack, who was brought up in the Oakdale Regional Center. He lived there for many years of his life, unfortunately, then moved out, was living independently, but had two dreams. He wanted to have a cat, which he could not do in his apartment, and he wanted to own his own home. And with some help from us, he was able to do both of those things. That house that you see behind him is owned by Jack. And so he went from a person living in an institution to becoming a homeowner. And actually, his mortgage payment on that house is less than he was paying in rent for an apartment, and he can have a cat there. The guy on the bottom is Rodney. I've known him forever. He grew up at Plymouth Center, and he left there. He was in a variety of different living situations, and finally he was looking for a place to live. We helped him find a place to rent in Beverly Hills that was a barrier-free house. It was owned by a woman who had disabilities herself. She was no longer able to stay there, but it was modified to be accessible. So we found that place, and Rodney and a couple other fellows were able to rent it. the woman passed away, and her daughter wanted to sell the house. And I remember this conversation like it was yesterday. Rodney looked at me and he said, "Well, where are you going to put me now, Mark? Because I can't stay here." And the symbolic truth of that was that, you know, we want people to have homes. We don't want people to get put anywhere. So we managed to cook up an arrangement where we were able to buy that house, and Rodney continues to live there to this day with a couple other guys. The next point I'd like to cover is that housing is truly a social determinant of health. And I've had many conversations with Dana and elected officials, many leaders who understand the significance of this, that if you don't have a stable place that you can call home, your recovery is going to be much more difficult. Your path to success in every other avenue of life is going to be much, much more challenging. So housing is one of the key determinants of health. As I mentioned, we're celebrating 20 years of service to our community as of 2021. We just finished that kind of commemoration. And again, a lot of our success has been attributable to our partnership with OCHN. And then finally, I want to mention the whole point of leveraging, because this was one of the key concepts when we first started. And that leveraging means that we're not only using mental health resources to help us accomplish our work and our partnership with OCHN, but part of our goal is to attract other non-mental health resources to help people with disabilities and others achieve affordable, attainable, desirable, integrated housing in their communities. And to date, Community Housing Network in Oakland County alone has managed to leverage over $100 million in non-mental health resources to promote affordable housing options. So that's my kind of brief introduction. I promise to keep it quick. So with that, Suzanne, can you turn on the video?
Early in my career, I had a chance to be part of Michigan's deinstitutionalization movement. That was the movement that took people with disabilities out of state-operated institutions and gave them a home in the community. Group homes were a big part of that initially. Michigan became the 11th state in the entire country that closed all of its institutions for people with developmental disabilities, which is a remarkable accomplishment and a testament to the commitment of both Republican and Democratic legislators and governors.
Okay, so I understand. See, we've got the sound, but probably not the video, right?
We can see the video in the room.
Okay. Well, if the folks in the room can see it, why don't we go ahead and run it?
To get that work done. At the same time, I think it's incumbent upon us to make sure that there's a safety net in the community, that people who aren't in institutions anymore and aren't going to institutions have a chance to live a safe, healthy, rewarding, productive life in the community, as a part of the community, as a valued member of the community. And affordable, decent, safe housing is a part of that. In study after study across the country, as a matter of fact around the world, it's been found that safe, decent housing is critical to successfully living in the community. It's critical to recovery.
This is my first time moving out on my own. I wanted to be independent and have my own life, and I was at the age where I thought it was the right time to move out. Living here has been good because it's been busy with school, relationship, and just roommates and getting used to it. I'm at OCC, the Auburn Hills campus, and I am studying, my class is police communications, and for my major, I am going into criminal justice generalist, which means I want to either do parole or something with the FBI. I'm finally in the house where I can do the dishwasher, wash clothes, because the house is so handicap accessible. I am part of the Michigan Victory Games. My team is the Mighty Oaks. In the Michigan Victory Games, I compete in 50-meter swimming, track and field, which consists of many events, table tennis. I have gotten multiple awards for competing.
My daughter, Julie, just moved into the Maddie Lou home. In the past 7 or 8 years, she's lived in a couple of different apartments with a roommate and 24-hour care. And this new home is a miracle for her and for my husband and I. We just are so at peace. She's so much happier. She is, of course, trying very hard to keep her room all nice and straight. She vacuums the floors. She's learning how to do laundry. And it's just so different than it was before. It's perfect.
Before this, I lived at home with my parents and my brother. I wanted to live independently. It was getting too much for my mom and dad because they're getting up in age, and they wanted to get my brother and I settled before if something ever happened to them, so I wouldn't end up somewhere else. This home is very nice. It was a little bit hard to move at first, because I think I depended more on them for a while. I've been at Hollywood Market for 13 and a half years as a bagger. It'll be 14 this year in September. I like working here because I know all of the customers by name.
Hi, my name is Daniel. Welcome to my home. Community Housing Network definitely gave me a new beginning. So this is Zila, and it's another indication of a new beginning for me because of Sharnita's suggestion, and she told me it could be therapeutic for me. She brings cutefulness and playfulness, and so I don't have to be depressed. And so it is very therapeutic. My mother raised me, and I had two sisters. I grew up in New York, and I didn't know my father. I never got a chance to meet him, but my mother did her best to give me a good upbringing. I played sports in high school and stuff, and eventually I didn't go to college, but I joined the Navy. And then when I joined the Navy, unfortunately my mother passed away like 6 months in when I was in the Navy. So I got an honorable discharge, but they called it an entry-level separation. And due to my mother's death, I think that that was kind of like a devastating thing for me. So the only solution I could find was I started drinking heavy. And during the drinking, that led to drugs. I started smoking crack. And basically from there, it's just like my life became like a living hell, if you will. And so I wound up in prison due to the drug use. I was homeless. I struggled with addiction. And my life was a complete mess. It got so bad where I didn't know if I was going to continue to even live. But somehow, like I said, I got connected to community housing. And but I always knew I had a strong faith that somehow God was gonna help me, but I didn't know where the help was gonna come from. And community housing, definitely, I feel like was a divine intervention. So with the housing and the stability, I continued to seek for employment, and I signed up with CNS Services as far as mental health. Got with an employment specialist. She let me know that CNS, there was a position available, and I got hired. I work for, it's an extension of the CNS. It's a place called Visions Clubhouse. So basically I transport to clients. You know, I bring them to the clubhouse, and then I bring them home, and then they go on field trips and things of that nature. And I'm seeing so many improvements in so many different areas of my life. The housing is giving me that opportunity to each day see a new beginning.
Okay, thank you. And we just have a few more slides to go through, so I'm going to turn it over now to my colleague, Kirsten Elliott. So Suzanne, if you can pull that PowerPoint back up.
Hello, everybody, and thank you for the opportunity to speak with you today about Community Housing Network. And I'm going to talk really quickly, because I know you got a packed agenda today, about the services that Community Housing Network provides. And this is truly an abbreviated version of all of our services. So our leasing and property management, we've been doing for 20 years. As Mark mentioned, it was one of the core pieces of the services that we provided to OCHN from the very inception of the Community Housing Network. And although group homes are not necessarily the preferred option for everybody, they do remain a large option for a large number of people. And it is our goal to maintain the houses in excellent condition and as desirable homes for people who have chosen to live there, and to make sure that there are lots of to make sure that we have options for a lot of affordable options for our people who desire something else. Over the years, we have dwindled the inventory of group homes, and we have kept the very best ones that are wheelchair accessible and that are scattered throughout the county so that people have options of where they might want to live. This array of group homes that are still in the stock are a true asset to OCHN and to our whole community and everybody who's served by the in the mental health system. Next slide, please. So we started Olink, which is and we started working with OCHN to truly facilitate choices made by people. So so that they can be where they want to live, they can find it easily. And Olink is making a big step to make that happen. It's an online tool that provides supports coordinators and case managers have the ability to search for available housing that is staffed by OCHN's staff service providers within the OCHN's network. Searches can find homes that are accessible, providers that excel in for caring individuals with unique needs, such as homes that are for the hearing impaired. There's also a roommate matching component to the Olink system for those individuals wanting to have a roommate where they can share the housing costs and also enjoy companionship. There's a lot more that goes into this, but just in the brevity of time, we're just going to move on to our Housing Resource Center. Our Housing Resource Center is, oh, you're at affordable housing. So I'll just go to that really quickly. So since whenever we talk to advocates and parents and families, the number one issue and concern that comes up is always the absolute need for affordable housing in Oakland County. And affordable housing in Oakland County is increasingly becoming more and more difficult to find and to access. So this has become a very important part of our services to the community. And Community Housing Network, we play a very strong leadership role in addressing this, not only within the county, but also addressing it at the state level with MSHDA, which is the Michigan State Housing Development Authority, to make sure that resources are coming to Oakland County and that we're poised to be able to develop as much affordable housing as we can throughout the community with CHN and our community partners. So, and again, developing affordable housing is very complex, and it has many different layers of financing and legal structures and construction management, and it goes on and on. And over the years, as Mark had mentioned, we've been able to leverage over $100 million with OCHN support in providing additional and for bringing in those resources to provide affordable housing for thousands and thousands of families. Next slide. So our Housing Resource Center, which is another one of our core services that we offer. And actually, when I started at Community Housing Network back 20 years ago, I was the Housing Resource Center manager, and I was the one taking all the calls of people and family members that were looking for housing resources. Our job is to demystify the housing process and to help people navigate a very complex and difficult system. And so all we've seen over the years is an absolute demand, a huge demand and increasing every year for the need for the Housing Resource Center and understanding housing and accessing housing. And it serves every kind of person in any kind of housing situation, from family members that want to have their children transition into independent living to people who are homeless. Our Path Outreach team works out of the Housing Resource Center, so working on doing street outreach for people who are homeless out on the street or in the shelters. They all get funneled through here and go through an assessment process to get people connected to the right resource, whether that's at CHN or whether that's with our other community partners. And one other thing I do want to add about the Housing Resource Center is that it is a key part of the new blueprint to end homelessness in Oakland County. And so we're really honored that we get to provide these services to the community. And finally, the point in time count is a very important, hold on one second, is very important for us. The PIT count, or the point in time count, is a mandated annual count of our sheltered and unsheltered people who are experiencing homelessness in our community. It's a point in time on one night of the year, and it's always in the last 10 days of January. The Alliance for Housing coordinates our PIT count in Oakland County every year, and this year it is January 26th from 7 p.m. to 11 p.m. There will be teams of volunteers that they're going to fan out across our community to look and count for those that are unsheltered and living on the streets. This data is then used to determine how successful our efforts in the community at ending homelessness are, and then we report those back to HUD. And then also the data is utilized on how the federal resources and the federal funds are allocated across to the different areas. So it's really important that we get a good, strong, accurate count, which is obviously very difficult to do in the time of COVID. But if you are interested in volunteering, you can find more information at oaklandhomeless.org, and there's the link right there on the slide. Mark? I don't know if he's coming back. So.
Yeah, I'm back. I'm sorry. It just took me a second. And these are our service locations, and we have our main office. Of course, that building might look familiar. We share the building with our community partners at OCHN and others, and we also have a small office in Macomb that serves Macomb County as well. And finally, here's the contact information for Kirsten and me, along with the phone number for our Housing Resource Center. And just one thing I would add is that our Housing Resource Center averages over 1,000 calls a month. And most of those folks who call are either current or eligible recipients of services from OCHN. Any questions that we can answer for the board?
Thank you, Mark. Let me see. Any board members with questions or comments? Okay. I don't see any, but I want to take a moment and thank you guys. I appreciate hearing the stories about Jack, Rodney, Julie, Kristen, and Daniel. The stories that inspire are what I really like about all of this. and I really appreciate the work that you guys do. I was trying to think of the pyramid, and you guys are covering housing, which is Mazoff, right?
Mm-hmm.
Got to have shelter to move forward with anything else. So thank you so much for the work that you guys do.
Well, and thank you for your continued partnership. We appreciate it.
All right, thank you. All right. So we've covered our committee executive chairs. So the next item on the agenda are approval items that require roll call votes, each one of them. So we have a budget amendment. And I'm looking because I see Anya in the back, but do we have one to get voted on at this meeting? Okay.
It was reviewed at the COW, recommended by the Business Ops Committee.
Okay. Is there anyone who would make a motion to approve the budget amendment? Does not require anyone from the Business Ops, but that's always nice, since you guys may be reported out.
I make a motion to approve the budget amendment. This is Adam.
Thank you, Mr. Furman. Is there a second?
Second.
Thank you, Dr. Taub. So we have a motion. We have a second. Is there any discussion on the budget amendment? Not hearing any, let's do a roll call vote. Please, Sheila.
Mr. Torres?
Yes.
Dr. Taub?
Yes.
Mr. Cowan?
Yes.
Ms. Root?
Yes.
Ms. Newman?
Yes.
Dr. Hans?
Yes.
Mr. Furman?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Item B on this list is the MEI Total Elevator Solutions Contract. Is there someone that will make that motion?
So moved.
Thank you, Dennis. Is there a second?
I'll second.
Thank you, Mr. Torres. So a motion by Mr. Cohen, second by Mr. Torres. Is there any discussion? Hearing none, roll call vote again, Sheila.
Mr. Furman?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Mr. Cowan?
Yes.
Ms. Root?
Yes.
Dr. Taub?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. So we're moving through these pretty quickly, but they were discussed at great length during the committee of the whole meeting with questions and answers, and they were, like the other three that we're going to go through, reported out of committee. So I'll move on to the third item, MCMI, for the HVAC contract. That's heating, ventilation, air conditioning. And is there a motion for that approval of that contract?
So moved.
Thank you, Mr. Cowan. Is there a second?
This is Christine, I second.
Thank you, Christine. So a motion by Mr. Cowan, second by Ms. Root. Any discussion? Okay. All those, well, we need a roll call vote again, please, Ms. Barrett.
Mr. Torres?
Yes.
Dr. Taub?
Yes.
Ms. Root?
Yes.
Mr. Cowan?
Yes.
Ms. Newman?
Yes.
Mr. Landsman?
Yes.
Sorry. Dr. Hans?
Yes.
Mr. Furman?
Yes.
Motion carries.
Thank you. Item D, fourth item on this agenda for approval items is the WDIV and the Scripps Detroit contracts, so Channel 4 and Channel 7, plus others. Is there a motion for the approval of this multimedia contract?
This is Christine, I'll make the motion, but I do have a question. Do we have to separate them, or we can vote for both?
They are two separate contracts, so I suggest separating them.
Okay.
So why don't we do that, to make a motion
All
on
right, I make a motion to approve the WDIV contract.
Okay, is there a second?
I'll second that. It's Adam.
Thank you, Mr. Furman. Okay, a motion by Ms. Root, second by Mr. Furman. Is there any discussion on the WDIV Detroit contract?
Oh, I have a question. I was just wondering how it says the projected impact of 30,714 people reached through television and social media campaign. I was just wondering how does that number, or how do they come up with that number?
Is Ms. Burke on?
I
Christine, I
am.
can see you.
Yeah, I am on. So those are developed by impressions and data in terms of how many individuals are identified and watching specific programs. What is the likelihood that someone will see a commercial? So there is an algorithm used by broadcast organizations to determine those figures and data when they share it with potential advertisers.
Okay, yeah, thank you. That's what I was thinking, and but I just wanted to verify that. So that's great. Thank you.
You're
Of course,
welcome.
we are one of, thank you, Christine, and we are one of those advertisers, if you will. All right, so there's a motion, there's a second. Are there any other questions? Hearing none, Sheila, will you do a roll call on this?
Mhm.
Item DA, or item D1.
Yeah, thank you. Dr. Hans?
Yes.
Mr. Furman?
Yes.
Ms. Newman? Mr. Cowan?
Yes.
Ms. Root? Yes. Dr. Taub?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
And for notification, I did separate it out in the meeting minutes.
Okay. Now we're looking for item D2, which is the motion for approval of the Scripps Detroit contract for multimedia. Is there a motion?
I move to approve the, Channel 7, Scripps contract.
Support.
Thank you, Mr. Furman. Thank you, Ms. Newman. So we have a motion, a second. Is there any discussion on this contract? Hearing none, let's do a roll call vote.
Mr. Cowan?
Yes.
Ms. Root? Yes. Ms. Newman?
Yes.
Dr. Taub?
Yes.
Mr. Torres?
Yes.
Dr. Hans?
Yes.
Mr. Furman?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Then last but not least is item E, and that's for the PIHP contract amendment number 4. We need a motion for that.
So moved.
Thank you, Mr. Cowan. Is there a second for this PIHP? Thank you, Ms. Newman. So there is a motion, there is support. Are there any questions or discussion on this item for the contract amendment with as a PIHP with the state? Not hearing any, let's do our last roll call vote on these items.
Mr. Furman?
Yes.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Mr. Cowan?
Yes.
Ms. Root? Yes. Dr. Taub?
Yes.
Mr. Torres?
Yes.
Mr. Landsman?
Yes.
Motion carries.
Thank you. Okay. Next on the agenda, so all these passed. Next should be our consent agenda. All right. So these are our board meeting minutes, our regular meeting minutes. So I need a motion to approve the consent agenda. Thank you, Ms. Newman. Is there a second?
Support.
Thank you, Mr. Torres. As a consent agenda, there are no discussions, so we move immediately to a roll call vote.
Dr. Hans?
Yes.
Ms. Newman?
Yes.
Mr. Furman?
Yes.
Dr. Taub?
Yes.
Mr. Torres?
Yes.
Ms. Root? Yes. Mr. Cowan?
Yes.
Mr. Landsman? Motion carries.
Yes. Okay, thank you. So I'll give you a moment to catch up. Okay, good. Next item on the agenda would be committee reports. Oh, it's other business, I'm sorry. Other business. And what do we have on other business tonight? Nothing? Okay, then we move on from other business to our committee reports. First one would be the Bylaws Committee, Mr. Torres.
Thank you. We have an upcoming Bylaws Committee meeting on the 20th of this month from 5:30 to 7:30. At this point, the Bylaws Committee has met several times. We've made it through the actual bylaws section. We've moved into the policies portion. And in that policies section, we've gone through the executive mandate section, specifically treatment of staff and financial planning and budgeting. We have other sections in the executive mandate to go through, and at this next meeting, we anticipate going through the rest of that section and then in to the board governance as well. We have been moving along for the past, I think, 6 to 7 months. But as we've gone back to in person, we've run into some issues that we may have in this month and then in February. So we're just keeping in mind that we would need to have quorum of our bylaws committee in order to move forward. But I did have a question, as Mr. Furman did have earlier, with regard to whether we would be allowed to meet virtual, but it sounds like from Kalana's response on the last question that it would probably be best to move forward with continuing to make sure that we are in compliance with Open Meetings Act by meeting in person. So I'm assuming that would carry the same here, but we're going to stay on track and hope that we are able to get things through and able to present it to the board in a study session by March, by the March study session. So then we can begin more discussions, as I'm sure the full board is going to want to have lots of discussion on the topics and some of the changes that we're proposing. That is my committee report. Thank you.
Thank you very much, Mr. Torres. Next item on the agenda is the Recipient Rights Advisory Committee and your report, Ms. Root.
All right. The RAC met on Thursday, January 6th, and Ms. Suter provided a presentation about the annual rights report and the rights assessment report, which included some of the points that she shared with us at our last committee of the whole meeting. And just to provide some key point refreshers, our total score was 422 out of 452 possible points. This resulted in substantial compliance. The 3 areas where we lost points were related to the content and process of complaint resolutions and CMHSP responsibilities. So Ms. Suter walked us through these specific findings, and she also explained what corrective actions the department is taking to improve the areas of the rights assessment that we fell short on. Our corrective action plan was due on January 10th, so I'm assuming that was sent in and hopefully accepted. The committee members had a lot of great questions and comments during this meeting, and we had some side discussions about details like how the appeals process works. And then lastly, Ms. Suter gave us a site visit report update, and we clarified some of our goals for this year. The next meeting is February 3rd at 4 p.m. Thank you.
Thank you very much, Ms. Root. Next item is, well, I'm not sure we're going to have a Citizens Advisory Committee unless she filed one electronically by Ms. Namie Dyer.
Mr. Chair,
Yes.
the meeting is tomorrow.
So then there would not be a committee report since the last board.
She would have provided a report from last month for the December report.
But I think
Right.
it happened before our board meeting last time, wasn't it?
The CAC is always the day after the board meeting.
It is?
So
Okay.
she would have provided December's board meeting.
Do you know if
or
she
board
did?
meeting. I did not receive an electronic copy.
Okay, thank you. And for SUD substance use. Mr. Cowan?
We're meeting this month. It's quarterly meeting.
Okay, thank you. I think that concludes our committee reports. On to our director's report. Ms. Lassenby.
Good evening again. Forgive me, it's a little hard to speak with this thicker mask on, so bear with me, please. The first thing I wanted to talk about is our continued support of the Oxford community and collaborating with our network providers and really working together to support the community after the tragedy, but also continuing to work in other supports and services through even developing a plan to benefit the individuals of Oxford who may have barriers to receiving care as a result of having high copays and deductibles. So we're working very, very closely with the Board of Commissioners, ways that we can create workarounds to those barriers. The other thing I wanted to talk about is that we are in the early development phases of developing our 3-year strategic plan. So this process really includes a very extensive needs assessment and drafting person-focused goals and objectives. Our priority really is to make sure that we identify the needs as a part of our strategic priorities, but also expand our justice-related initiatives and our ongoing response to COVID, and implementing more programs for school-based mental health services and supports. So this information we gather through our assessment is really used to develop some data-driven and solution-focused programming with measurable and reportable results. So that's really critical to us going forward. And just to highlight a few things in my report, again, I repeat the strategic priorities, which is to enhance and expand access to non-emergent and crisis services. Also, integrated behavioral health care continues through our behavioral health homes, our certified community behavioral health clinics, as well as we are now in the process of developing a substance use health home as well. We also are looking at ways to improve our system of care for children and families, as well as relationships with our providers, and looking at value-based outcomes in the work that they're due. And we continue to work on ways to support our workforce. Of course, there is a crisis right now with the direct service professionals and direct care workers, including licensed clinicians, to support the work that we do. So we're looking at ways to develop programs to recruit and retain those critical need areas of staffing. The other thing I wanted to highlight in my report has to do with our Oxford response and updates in terms of us tracking the work that we're doing. In terms of access and crisis calls, we received directly related to the Oxford incident, we received 115 calls. We also served 1,455 people during the crisis response events. So one of the other critical things that we're looking at is our vaccine information, and we know we have some work to do in those areas, particularly to those folks that are homebound and have difficulty getting out to get their vaccinations or their boosters. So we had a meeting actually today that included was led by Dr. Pozios and other chief medical officers throughout our network. And we also invited members of the CAC and RRAC to talk about ways that we can provide vaccinations to people in residential support settings. So again, I'm looking at our numbers of people who are testing positive. And so if we compare December and January of people who tested positive living in residential, already in January 15th, we have 18 people who are testing positive, which is high compared to previous months if we continue to trend at this rate. So that concludes my report. If you have any questions, happy to answer those.
Ms. Newman?
Yes, Dana, I was just wondering, what's the board's role with the strategic planning? Are we going to have any input at all?
Absolutely. As we could start with our needs assessment, we'll be sending out surveys and inviting the participation of the board. And my thought is that during one of our board study sessions, that is part of what we'll cover?
So the needs assessment is getting developed right now. It's going to go in front of the February CAL meeting, in front of the board for review and suggestions, and then it will come back for approval. At the February, we'll implement the suggestions from the board, and then it'll come back for the approval at the February board meeting. And then the outcomes will come back. And then also for strategic planning, once that gets developed from the needs assessment, that is also going to go in front of the board for review and recommendations. So.
Other questions? Yes, Ms. Root.
When I look at this table of the different call categories, it reminds me that I recently recommended to someone who I met in my personal life to call OCHN to see if their daughter could get connected to services. She has an intellectual or developmental disability, and they are not on Medicaid. So what I heard is that they didn't qualify for anything. So what can we do in those situations? Because we're a leader in this county, right? People are going to call us whether they qualify or don't qualify for services. And I hate to hear that someone was left without something, some type of information or referral. So what do we do in that situation?
You know, what I'm finding, and since I started here, is that the community education part is critical, but also when people are calling requesting services, they have a right to a second opinion, but even beyond that, we're supposed to provide information and referral. So what my question would be is if you could share that information after the meeting, we can follow up and see where the barrier was. But that's one of the critical pieces is that we found through the School Mental Health Navigator program is that even families who have insurance or who are uninsured, they don't necessarily know how to navigate and get access to services. So that Mental Health Navigator program will actually work with people who are insured, but in your case or your situation that you're talking about, that would be of concern if this is an individual they deemed as not eligible for services. So I would like to see that and follow up.
Okay, thank you.
Mm-hmm.
Other questions for our executive? Yes, Dr. Hahn.
Yeah, the point that Ms. Root presented is very important.
Mm-hmm.
It was true 25, 30 years ago when I needed help for my son who had insurance. I think it's very important that we take the lead in directing or at helping our citizens to navigate the system and to access to the resources. So I think that is one important part. I think eventually when these children go into adulthood, they will obviously come into our sphere. But I think an informed person has more power than somebody just trying to navigate the system blindfolded. So,
I definitely agree with you, Dr. Hans. And what I will also say is that when we're looking at reporting, we need to look at those calls that weren't actually connected to services and identify why. Because I think if we see a trend where we're telling people to call somewhere else, that's a critical point in which we may never be able to help that person again. They may not call back. So we'll start to look at that more closely because that is something we definitely don't want to happen, especially now that we're out there in the community more and more and we're telling people to call us and there's no wrong door and they're being turned away. So we need to identify where the barriers are for people attempting to receive services.
Yeah, and I think our contract through with Channel 4 and Channel 7 probably will be very helpful in educating people. Thank you.
I agree.
Other questions? All right, thank you very much, Dana. Next on the agenda is, I believe, public comment. Suzanne, is there anyone who's...
We do not have any additional public comment in the online form.
All right. Well, I will just say for those that are watching or will when they replay this, please consider public comment. Send it in electronically, do it during our meeting, show up. We would like to hear from you to know where we could do a better job, where we're doing a good job. The whole point is to empower and to strengthen our communities, and the only way to do that is to get feedback from all of you, and not just through our survey. So thank you. All right, next is board comments. Sheila, would you like to go through the roll call and have us, if there are folks that would
Sure.
like to make public comments?
Mr. Torres?
I just want to thank everybody for the presentations tonight, and I think learning a lot about housing and hearing about how, you know, that is very important to the stability of helping people. You know, I think that is key. It's very important to give people that opportunity. I wanted to also recognize the bylaws committee. They've been working very hard. I appreciate all of their efforts. It's definitely been difficult, you know, in the pandemic, and now we're back to in person, and it's nice to be back in person. But obviously, we would love for the numbers to be better. So hopefully, we'll get there. Also, just wanted to mention in Dana's report as well on the vaccination that you know, numbers are low, obviously, but I know that you guys have been working to do clinics and things like that early on to help get people their shots and boosted. So perhaps we could do something like that again in the future. Thank you.
Ms. Newman?
I don't have a comment, I have a question. Has any thought been given to having plexiglass on our tables during the meetings? I would feel better.
I have thought about that, and I know that that is something we're going to be discussing with the facilities manager, Mark. So that is something that we can look into.
Mr. Cowan?
Yes, I just, one suggestion on the strategic plan. I'm sure this is already part of it, but a robust, robust program to try and attract workers into the group home setting and behavioral home setting, because this is a challenge more than ever, and I don't think we're going to solve it by not finding ways to recruit. You know, it dawned on me that, you know, in high school, you know, we have trade schools for kids to learn how to fix automobiles, which is needed, but so are jobs in the mental health area and special needs area, that as much as we'd like to have a college degree, may not be able to have a college degree in those particular settings. So, but still can be very effective workers. So that's my one thought for the day. Thank you.
Ms. Root?
No comments, thank you.
Dr. Taub?
No comment tonight.
Dr. Hans?
No comment, thank you.
Mr. Furman?
Thanks to Mark Craig and OCHN, and just to echo John Paul's comments, thanks to staff for putting the presentations together. Everyone be safe and have a good night.
Mr. Landsman?
I would like to also say thank you to Mark and company for your presentation and sharing with the stories of Jack, Rodney, Julie, Kristen, and Daniel. It inspires hope for others, it empowers people to live on their own, and it strengthens the communities where they live. So I love that it ties very clearly into our mission. So thank you. Thank you to the staff for helping get things done, even things I can't even think about, but you guys seem to get it all done. So I'm impressed. Dana, thank you and your team and all those out in the field. So thank you. If there's no other comments, we've completed our agenda, so we are in adjournment.